PAD is a chronic disease. What this means is that once you're diagnosed, it is something that you are going to have to manage throughout the remainder of your lifetime. It's not something that you can necessarily fix and it goes away, but what you can do is to undertake measures to reduce your risk. So for patients with PAD, and I'd say for any patient with a chronic condition, one, there's no easy button, and two, you have to manage your health like you're the CEO of your healthcare. You need to manage your health as if you want to be healthy for life.
Patients with peripheral artery disease have a number of treatment options that really start with non-invasive treatment. And non-invasive treatment, the mainstay is a walking program. And in my practice, I typically advise a walking program of a few months to ensure that patients have a relief. If that relief is adequate, then that is all we really need to necessarily achieve for a patient with claudication. We can add medications to that program if they are not achieving the results that they would like with just simply a walking program. The invasive treatment options for PAD include surgery and endovascular techniques, which are performed in the catheterization lab and include balloons and stents and other means to improve the blood flow in the artery.
So the determination of whether somebody needs a stent or somebody needs an open procedure is usually based off of the severity of the disease. If it's just a small area of narrowing or blockage, then typically a stent will do very well in those patients. However, if it's a very extensive disease involving the entire leg, multiple areas of blockages, then typically a bypass or an open procedure would be more appropriate.
But we know from several studies that patients who are on a committed walking program over several weeks to months tend to be able to walk farther and feel more confident in their functional performance than people who don't participate in an exercise program. And so walking is really the fundamental place to start for treatment.
When patients begin to have lifestyle limiting symptoms to where they can't go to the store, they can't go to the park with their kids or grandkids, then those are patients in which it's more appropriate to proceed with interventions such as a balloon and a stent or a bypass procedure.
And we also talk about ways to improve the blood flow or revascularization of the artery disease, essentially relieving the blockages in the arteries. There are two important ways we do that. One is with bypass surgery. That's the traditional way of fixing these blockages. But technology has come a long ways, particularly in the last 10 years, where we have very durable treatment options now where we can use balloons and stents and other techniques to clean out the arteries, so to speak, to improve blood flow. It's important to tell patients, though, that this is not a disease we cure per se. This is a disease where we can improve the functional limitations that the blockages provide. But those blockages, if patients don't take care of themselves and continue to be physically active, can come right back. More and more, the cost of treatment is becoming really central to the discussion of how we treat people. And for those with insurance, it's a bit easier, but even then, these treatment options are, really vary widely in the amounts of money that it could potentially cost a patient to undergo, both in time away from work as well as financially.
You can leverage community health programs that can provide you with coaching opportunities to understand how to adopt a healthy heart diet. You can also engage in community-based programs to provide you with opportunities for supervised exercise. And I always encourage people to consider supervised exercise first, rather than just trying to engage in an exercise program on your own. And finally, there are a lot of community-based programs, many of which are free of charge, that allow you to engage in chronic disease self-management programs.